All right, good morning and welcome to the class on asepsis and infection control. My name is Christine Duncan. I am one of the nursing instructors here at Southern Wisconsin Center. Let's go over our learning objectives for today. So we are going to learn about some key terms and define those. We're going to identify modes of transmission and common infectious pathogens. We're also going to identify common signs and symptoms of infection. And then we're going to learn about proper hand washing and personal protective equipment. So before we get started, let's go ahead and we're going to do a group project where we're going to list signs and symptoms, ways to protect yourself, and also current issues in infection control. So let's go ahead and break into groups and we'll get started with that. All right, you guys did a great job with listing signs and symptoms and then other infection control issues. It sounds like you have a really good basis of knowledge to start this class. So let's go ahead and start defining some of our key terms. Asepsis is the absence of pathogens, and pathogens are bacteria, viruses, or other microorganisms that can cause disease. A nosocomial infection is an infection that will be acquired in a hospital or other healthcare type setting. MDRO, which stands for multi-drug resistant organisms, are pathogens that are resistant to most antibiotics. They're typically a bacteria and they're known as superbugs. Bloodborne pathogens are infectious microorganisms that are found in human blood and can cause disease in humans. Some examples are hepatitis B and C and HIV. Vaccination is treatment with a vaccine to produce immunity against a disease. The chain of infection is a tool that's used to show the spread of infectious agents and how they can potentially lead to an epidemic. The chain must remain connected for the epidemic to continue, and breaking any link in this chain is going to stop the epidemic from continuing to occur. Ways that we can break the chain of infection would be hand washing, environmental cleaning, sanitizing and disinfecting of surfaces and objects, immunization and vaccination, personal protective equipment, practicing good personal hygiene and coughing and sneezing etiquette of coughing into your elbow instead of into everyone's breathing air, proper food safety, handling and storage, pest control, proper waste disposal, and practicing or participating in antibiotic stewardship. Some modes of transmission or ways that infectious agents are spread would be direct or indirect contact. Direct contact examples would be from person to person, from touching or coming into contact with other bodily fluids of another individual. Droplets would be coming into contact with pathogens that are found in people's sneezes and coughs. That's why we recommend coughing and sneezing into your elbow instead of everybody's breathing air. Indirect contact are things such as airborne transmission. Small particles can linger in the air of certain pathogens, and when you breathe those in, you become infected. Touching contaminated objects, so if an infected person touched on the surface and then you do, you can become infected. Consuming contaminated food and drinking water. If you are bitten or scratched by an animal, or if you're handling their fecal matter, you can inhale that, and that would be a way to become infected. Insect bites or vector-borne would be through blood-sucking type insects such as fleas, mosquitoes, ticks. When they start to suck your blood, they can contaminate you with an infectious pathogen. And then environmental, soil, water, like we talked about, consuming that, or if you don't wash or prepare your fruits and vegetables in a safe manner. You've heard me talk about this a couple of times. PPE is personal protective equipment. These are going to be items that we put on to protect ourselves against pathogens. Gloves to protect our hands, gowns to protect our skin and our clothing, masks protect our mouth and nose. Respirators are a little bit more of a specialized protector for your respiratory system. They filter out smaller particles. Goggles will protect your eyes. Face shields protect your face, mouth, nose, and eyes. Factors to consider when choosing your personal protective equipment. What type of exposure do you anticipate? Is it going to spray or splash in your face, or is it something you're just going to touch? What type of isolation precautions is your patient under? You also want to select something that's durable and appropriate for the task that you're going to perform. And you always want to make sure it is a good fit, not too small, not too big. Standard precautions, sometimes known as universal precautions, are going to be the ones you practice with everyone. Anytime you're going to come into contact with a bodily fluid such as blood, saliva, non-intact skin, rashes, mucous membranes, you're going to want to be wearing gloves and practicing good hand hygiene. Occasionally you might need to put on a gown or mask or gowns, masks, or goggles, but generally it's just going to be hand washing and putting gloves on. Isolation precautions, there's 3 types: contact, droplet, and airborne. For contact precautions, we're going to be putting on gowns and gloves, and this is going to be used when you are worried about spreading something from coming into contact by touching. So MRSA, CRE, anytime there's an open wound or sore, or if there's diarrheal illness is when you're going to use your gowns and gloves or contact precautions. Droplet precautions are used for diseases or germs that are spread through tiny droplets in coughing and sneezing, such as pneumonia, influenza, bacterial meningitis, or whooping cough. In that, you're going to be putting a mask on to protect yourself whenever you're working within 3 feet of that individual. Airborne is used for diseases where very small particles are remaining in the air, such as during tuberculosis, measles, or chickenpox. For that, you're going to use one of those custom-fit respirator masks, and usually those patients will be in a negative pressure isolation room. If you're not sure, there will be signs posted outside of the rooms, and they should list on there which types of personal protective equipment you need to put on before you enter the room. Some common pathogens you might see out there: C. diff or Clostridium difficile. It's a bacterium which infects humans and other animals. Symptoms can range from diarrhea to serious and potentially fatal inflammation of the colon. Influenza, it's a highly contagious viral infection that affects your respiratory tract. Norovirus is another highly contagious viral gastrointestinal illness. It's most commonly known as the stomach flu. MRSA, or methicillin-resistant Staphylococcus aureus, is a bacteria that causes infections in different parts of the body and is difficult to treat due to its resistance to many antibiotics. Similarly, CRE, carbapenem-resistant Enterobacteriaceae, it's another family of germs that are difficult to treat because they are resistant to the last line of defense as far as antibiotics are concerned, and those are called carbapenems, so it's pretty serious. We went over some of the common signs and symptoms during our group project, so those are available in your handout for your reference. Hand washing, single most important measure in preventing the spread of infection and pathogens. It's the first line of defense in protecting both yourself and your patients for infection control. CDC recommends 20 seconds of vigorous scrubbing with soap and water to thoroughly and properly wash your hands. They also recommend use of alcohol-based hand sanitizers when soap and water are not available if your hands are not visibly contaminated. The only time that those are not really effective, you can't use it against C. diff. C. diff is not killed by alcohol-based hand sanitizers. So now we have a couple of videos to watch about proper hand washing technique, and then we're going to do a group activity with a black light and some germ powder to see how well you wash your hands. So let's go ahead and do that now. Well, that was a pretty fun activity, wasn't it? Seeing how well we wash our hands and maybe areas we need to improve on. Now we're going to watch another video. You can follow along with these slides. This talks about how to properly put on and take off your personal protective equipment, and then we're going to practice that. So let's go ahead and do that now. Okay, now that everybody knows how to put on and take off your personal protective equipment properly, let's review our learning objectives for today. So we learned some key terminology, and we learned types of precautions, our common pathogens, common signs and symptoms of infection, and then we were able to define and demonstrate proper hand washing technique and how to select and properly put on and take off our personal protective equipment. We are going to wrap up by doing a quiz to make sure we learned everything we need to learn today. But first, does anybody have any questions for me? Otherwise, thank you for your patience and your participation today, and let's get to that quiz.